Yes, sir, we're live.
Yeah,
Yes,
great.
sir.
So
So,
do I start
uh,
right away? Hi, hello everyone.
yes, sir. So, hello everyone, and welcome to today's session. This is the fifth part of a week-long series of Webodontia, and these events are brought to you by the Roadside Club of the Producers, an organization of youth medical and paramedical students. And the Webodontia is a week-long event with educational webinars blended with fun activities. And before we begin, I'd like to mention that a recorded version of this webinar will be available on our YouTube channel, and the forum for questions will be open at the end of the webinar. The feedback form for availing the certificates will be provided in the chat box on Cisco WebEx as well as YouTube Live. And with that being said, I'd like to introduce you all to today's presenter, Dr. Ashwin Rao. So, Dr. Ashwin Rao obtained his MDS in periodontics and preventive dentistry from Manipal College of Higher Education in 2005, and he was awarded the Vidya Tandon Memorial Gold Medal for the best outgoing postgraduate student. And he won the Best Teacher Award by Manipal Academy of Higher Education for the academic years 2012 and 2013 and 2016 to 17. And he has co-authored a textbook titled Contemporary Treatment Techniques in Pediatric Dentistry by Springer Publications, released in April 2019. He has co-authored a video chapter titled Stainless Steel Crowns in Pediatric Dentistry, released by Springer Publications in March 2020. He won the Guidant Dental Academic Excellence Award for the most proactive junior academician in periodontics for the year 2016 and 2017. He has been a guest speaker on midazolam sedation in pediatric dentistry at various national dental forums. And he has 33 publications in international and national journals. And he has also received an award for Best Audiovisual Presentation instituted by Mahe for video chapters on inhalation sedation, strip crowns, and IV sedation with midazolam. And he is the co-owner of Tiny Teeth, a children's dental clinic. And there are two branches of this clinic in Mangalore. And it is an absolute honor to have you enlighten us about the importance of EQ versus IQ for doctors today. And thereby introducing to you Dr. Ashwin Rao. Over to you, sir.
Thank you so much, Pranjali, for that very generous introduction, which I myself shared with you. Yeah, right. So
Are you able to share your screen, sir?
yeah, let me try. Let's share there my PowerPoint. Is
Yes, sir, it's visible.
so all right. So can I start now?
Yes, sir.
Great. All right. So good evening, everyone. Uh, I like the title that the organizers have selected, Empathy versus Brilliance. That's a nice title. Uh, you students have joined us on a Sunday evening, 6 o'clock. So yeah, so I'm going to keep this presentation very short. It's a Sunday evening. I don't want to go on and on. I'll make sure it is interesting, and at the end of it, I also make sure that when I say interesting, it does not come at the cost of content. Sure that there's at least one good take home point for all of you students from this session. All right, so let's get on with it. Empathy versus brilliance. Now, that basically translates as, yeah, that basically translates as IQ versus EQ. Now, what is IQ? IQ is fairly easy to understand. All right. Now, IQ is all of us have a high IQ here, I assume. I have done my BDS, I've done my MDS, I'm an academic, I run a practice. I'm sure I have a fairly high IQ. So do all of you. All of you have passed your 12th standard, have come into BDS or MBBS through uh, uh, competitive examination. So all of you, rest assured, have an high IQ. But what about EQ? Now, what is EQ? EQ means emotional quotient. Now, EQ is a slightly more difficult term to understand. It's like talking about what is success, what is leadership. It means different things to different people, and there are various interpretations. Now, I'm a pediatric dentist, so I'll try and interpret EQ through uh, what I feel is because I deal with children all the time, and I have children who are scared, children who are expressing various emotions when they walk into my clinic. So I'll try and discuss EQ through uh, yeah, what is the difference? Okay, let me get here first. What is the difference between EQ and IQ? Like I told you, if you search Google now, there are various differences given between EQ and IQ. Let's see what's the first one. Is it helps IQ helps you get in the door and EQ helps you succeed at the job. So there are, like I told you, there are various interpretations of EQ. It's a very big field. Now, me being a pediatric dentist, I'll try and understand EQ. And I feel that to understand EQ, you first have to understand what are emotions. And to understand what are emotions, the best way to understand emotions is by understanding the psychoanalytical theory by Sigmund Freud. Now, if you are in third BDS, some part of theory would have already been taken for you, but this is not going to be a theoretical part. I'll try and dissect emotional quotient through this psychoanalytical theory for you in this session. All right. Okay. Now, according to Sigmund Freud, there are three mental processes in your brain. There are three imaginary mental processes in your brain. Okay, now these components are called as ego, and the superego. All right. Okay, so now these are not anatomical structures or don't have any physiology either. I repeat, these are imaginary mental processes which are there inside your brain according to Sigmund Freud. Now let's dissect them and let's simplify what they are. What is Eid? All right, Eid is a set of aggressive emotions. Now I use the word aggressive for want of a better word. All right, they are not. It's not that they are aggressive emotions. You can use words like maybe strong emotions. You can use a word bold emotions, whatever. But under Eid, you have emotions like anger, jealousy, impulsive behavior, extreme tense behavior, or extrovert behavior. What is superego? Superego are your set of passive emotions that can include lack of self-confidence, self-pitying, anxiety. You know, some people are eternally sad, shy behavior, introvert behavior, or people with a very strong conscience where they're not able to make a decision. This decision, what will that guy say? If I make that decision, what will this guy say? That kind of behavior. So let me make it clear. I'm not saying any of these emotions are good or bad. Okay, emotions are necessary. Both this set of emotions are necessary. All right. What is bad is if these emotions, dominate when you have a particular problem or a challenge in life. Okay. Now, so you know what is what is superego? What does ego mean? Ego, you associate ego with words like reasonable, logical, balanced, mature. Okay, so according to Sigmund Freud, whenever you're faced with a challenge in life or a problem in life, professional or personal, big or small, then there are two set of emotions fighting for dominance inside your head. You have Eid fighting for dominance and your superego fighting for dominance. We'll try and understand these through some examples in a lighter vein later. All right. Now, what the ego has to do is it has to take into account both these set of emotions and come out with a very mature, reasonable solution which will help that individual solve that problem and go forward with more confidence. And when the ego does that, that is called as a mature ego. All right. That is, that helps your emotional quotient. That helps you become a more balanced individual. When you solve a particular problem by, when you resolve a particular problem by taking into account both the ego and the superego, and you come out with a reasonable solution, these people tend to have a high EQ. All right. Okay. Now, if you find that information too much to process, you'll understand as we go along. All right. Now, you heard this term called as hurt ego. What is a hurt ego? Or you've heard this terminology. This guy has got an ego problem. That girl's got an ego problem. What does that mean? So basically, what that means is, when the ego is not able to resolve a particular problem, okay, and the id and the superego are fighting within the brains, within the individual's brains, then when ego is not able to resolve that problem, that is when you end up with a hurt ego. And these if the ego is not able to consistently solve problems, that is when you say that this individual has got an ego problem, that is basically what it means is, or where that term comes from is, that means this individual does not have a very high EQ. All right, a low EQ individual who where emotions are on display, where one set of emotions take over that problem, and he reacts through those set of emotions, either id or superego. All right. All right, I'll just change the temperature of the AC. All right. So, like I told you, if you find this information difficult to process, this way. All right. This is a simple way of looking at it. Either somewhere where the car is traveling at 95 kilometers per hour, very fast. You can use any term for it. Very aggressive, very fast, very bold. The chance of meeting up with an accident is high. Whereas super ego, it's going damn slow. The car is just about crawling along. Whereas ego is that the car travels at a very mature or at the recommended speeds. Okay, so this is also one simple way of looking at the concept of ego and superego. All right. So Pranjali, this one, if anyone's got doubts, let them interrupt me, and you can maybe ask them the doubt, because let them be clear with this concept before we go ahead. So please feel free to stop me anytime. All right.
All right, sir.
Yeah. Okay. Ego and superego. I hope this concept is clear. Okay. All right. Now let's go ahead. Emotionally mature people, or people with a high EQ or high emotional intelligence, whenever they are faced with a problem or challenge in life, a big or small problem, personal or professional problem, they deal with it. They consistently have the following six characteristics, and they deal with each problem by taking into account these characteristics. The first thing that they do is they push both set of emotions aside. So they push the set of emotions associated with either side, and the set of emotions associated with superego aside, because they understand that when there's a problem, emotions are the ones that bring in stress. So you can't come out with a reasonable solution to any problem when there are emotions clouding your judgment. So they consciously try and push the emotions aside, so that they are stress free, and they think with the ice on their head. They are totally cool. Okay, so this is the first thing that they do: push both set of emotions aside. Thing. extremely confident people, regarding of the circumstances around them or regarding of what people tell them. They are very selfish, all right, and their confidence doesn't go up and down depending on how each day turns out. Themselves and their own destinies. Self-assured. They always tell themselves like, whatever the problem is, okay, I'll sort it out, not an issue. Okay, so they are this kind of individuals. So two things: they are able to push their emotions aside consciously. They are confident regardless of the problem. Failures as experiences. So one of the things with the problem is, you more than the problem, you begin to consequences. All right, now more than the problem, you begin to think, oh my god, now because of this problem this will happen. For example, if I fail in the exam, more than the failure, your imagination starts to go wild. If I fail, oh my god, my parents are going to thrash me, my friends are going to go into the next batch and I'm going to be left behind. Oh my god, I mean, my career is going to is going to set back by another 6 months. These kind of consequences add a lot of pressure, and this is where again the emotions come in. Two sets of emotions are fighting. Okay, you so what these guys, people with a high EQ, do is they again consciously decide not to think of consequences. All right, they understand that failure is an experience. Okay, failure not in exams, I'm saying any kind of failure, if they are not able to solve that problem, whatever happens, all right, it's an experience, life goes on. There'll be another window of opportunity opening there. Till you're alive, life keeps throwing up opportunities. There are always going to be fringe benefits from this particular problem, even if I'm not able to solve it, that's okay. So they don't allow emotions to start telling them about consequences, and they don't think about it. So again, three things: push both set of emotions aside. They are very confident, and they are ready to accept failures. They know that life, this is only a battle. The war is life. You get the next set of, life keeps going on. It's like a movie, it keeps going on, it doesn't stop with this problem. So they look at experience, and they don't think about consequences. They have a positive outlook towards life and people. They don't blame anyone else for this present circumstance or problem that they are facing. They don't say that this guy backstabbed me and that's why this problem has happened, or life has been unfair to me, or it's bad luck, or god has been unfair to me. No, they don't look at it that way. They always have a positive outlook towards life and people. They know that the buck always stops with them, okay, or the buck stops with me. Okay, now I'm facing this particular problem. It's my responsibility. It's happened because of my actions. If someone's treated me badly, it's because the way I behaved with them, or when I spoke to them or whatever. I gave them this impression that they can take me for granted, and that's why he's gone ahead and taken advantage of me. So finally I am responsible, he's not responsible. So when you have this attitude, it helps you move on and find solutions. Otherwise you are like a crybaby, you are sitting and trying to blame everyone else for your problem. All right, that doesn't help you go forward. Fifth thing, they are not loose cannons. Loose cannon means always understand people will judge you, and people will judge you based on what you speak, how you behave in a particular situation, and that creates a perception about you, and people will treat you based on their perception about you. All right, so people with a high ego, they talk, they just don't let their guard down all the time. They know when to let their guard down and when not to let their guard down, and keep their cards close to the chest. They're smart people, so they're very measured in their approach. They understand that the tongue can be an asset, the tongue can be a liability as well. So they are not loose cannons. They just go on talking, or they don't have this kind of verbal diarrhea, they're very measured and they're very cautious when they speak because they understand this basic philosophy that people judge them and people will treat you based on their perceptions about you, right? And finally, the most important thing, they don't just sit and cry about the problem. They know that finally, they look at the problem as what we can do about this particular problem. Fine, we can push both set of emotions aside. Ready to it as a failure. They know they are responsible for this problem. They are not those kinds. But finally, the solution to the problem has to come by doing something about it. So they don't think about everything else. They see what can I do about this particular problem. So they are ready to work hard. They are ready to pull up their sleeves and say, all right, now this problem is there. Let me see how I can solve this particular problem. All right, so they are ready to work hard. So these are six set of characteristics generally you see with people who have high EQs. Okay, so you can make a note of this, and yeah, as we go along now, I'll give you a couple of funny examples maybe, and see how problems can be solved by taking by applying these characteristics. All right, so let's come to the first problem. Let's assume, I've opened a dental clinic now. I was an academic all these years, and somehow now I felt that, yeah, I should move away from academics and get into full-time practice. So let's assume I've specialized in endodontics and implants. So I've done a fellowship course in implants, and now I've managed to save a lot. So I've decided to put all my savings into this new practice that I'm opening. And I don't want to leave any stone unturned. All my savings I've put in my practice. It's a bit of a risk, I know, but I'm confident because of my hard skills in endodontics and implants. I'm very confident that I'll do well in practice, and it's a good investment. All right. Uh, my wife, let's assume, is a homemaker, and my kids, two kids, are both in school, going to school. So I have responsibilities on my head, but I'm confident. I'm confident that I'll do well in practice, and I've given up my academy. I don't have any other source of income, but still I have taken this risk. So I've opened this very, very good clinic called as a dental care clinic. All right. So after the inauguration and everything, second day of my clinic, I'm really, really excited. It's been my dream to open my own practice, and I've appointed a receptionist. I have two attenders who are going to help me, and I'm sitting in my clinic now. The second day, no patients have come in, but I'm not too concerned now. Patients, they'll take time to come. It's only the second day. So I'm not too concerned. So it's a great day, day two. Now, day five, not a single patient has walked into my clinic. Now, I'm still not very concerned because, yeah, it's day five. It takes time, isn't it? All right, day five is still too early. I'm getting a little. There's nothing to do. As an academic, I was going to college. There were my colleagues and my students were there who brought in so much energy. And socially it was great. Now in my practice, I'm sitting all alone with the two attenders, not exactly where I can make some great conversation, and I'm just sitting watching Netflix, and I've got nothing to do. But okay, anyway, I'm not too concerned. Day 15 and not a single patient has walked into my clinic. Now I'm getting a little concerned now. This is getting a little frightening. Not a single patient has walked in, and yeah, the EMIs have to be paid. I've got some savings still. The school fees also have to be paid, and I have to run a house also. At least I was hoping a couple of patients will walk in by now, but nothing has come in. Day 15 has come. Now I'm getting a little concerned. All right. Now we'll go to day 30th. Now, day 30th also, the entire month, not a single patient has walked in. Not a single patient. Oh my God. Now this is a catastrophe. The EMIs are going to come. Yeah, the savings are there, but they're going to disappear very quickly now. And if this is going to go on and on, I'm going to be ruined now. What am I going to do? And at this I can break down, saying, yeah, I'm a loser. That's it. That's the end of it. My practice is not going to pick up because day 30th, sitting alone in the clinic the whole day, even my imagination has gone overboard now. And this has turned out to be a disaster because all the time I was sitting and waiting for patients, nothing, nobody has come in. Even the attenders are yawning in front of me, and I feel responsible for them as well. And what will they be thinking about me? And this, that day I go back home in a very, very foul mood, imagining that everything is over, ruined. And when I walk home, my son opens the door. He's a 6-year-old boy, and then he comes and tells me, Dad, let's play snake and ladder. But I'm in a very foul mood. I shout at my son. I tell them, what snake and ladder? There are only snakes in my life. There are no ladders. I'm a loser. Then my wife is also a little scared now. I mean, what has happened? I mean, why is my husband behaving like this? And then to gain my wife's attention and sympathy, I throw a few things around, throw a few vessels around, throw my mobile around, just to gain her attention and sympathy, because I'm in a very bad state of mind. Now this is how a person react to a particular problem. There is a problem. There is a big problem. You can't deny it. 30 days, almost all my savings into it. EMIs have to be paid. The family has to be run, and not a single patient has walked in. There is a problem. There is a problem. But if I'm an more often than this, how I would have reacted. All right. Now, if I'm an emotionally strong person, if I'm a person with a high EQ, now then how will I deal with this particular problem? There is a problem, of course. Okay, so I'll deal with this problem by taking into account these 6 characteristics again. What am I going to do first on the 30th day? All right, I'm going to sit back and think, all right, there is a problem. All right, so the first thing I'm going to do is consciously I'm going to push aside both set of emotions, the emotions associated with Eid, which tell me, oh, you're a loser, oh my God, what is going to happen? These kind of emotions, I'm going to push them aside. And I'm also going to anger, frustration, I'm going to push aside these emotions. I'm also going to push aside the emotions associated with super ego, that is, those kind of emotions where I'm sad, where I'm crying, where I'm thinking that I'm a loser. I'm going to push these set of emotions aside because emotions are going to cloud my good judgment. So I'm going to consciously push them aside. Second thing, I'm going to tell myself, all right, no, I've had problems before, okay, and I've solved them. Okay, so my destiny is very strong. I'm going to get across this problem as well. All right. Okay, nothing's going to happen. This problem is going to get solved. Let's see, no problem. I have faith in myself and I'm going to crack this problem. Okay, this is what I tell myself. My confidence, I'm never going to allow it to dip. Or, if some friends call me and tell me, oh my, I heard you're, not doing really well in your practice, I'm not going to let that affect my self confidence. I'm going to tell myself, all right, my destiny is strong. Okay, if not, there's something else. Let's see. Okay, so I'm not going to let it affect my confidence. The third thing, I'm not going to think about consequences. What is the worst case scenario? The worst case scenario, fine, I'll close my clinic, but I've got an MDS degree, I've got a solid reputation in academics. I'll see if there's any other job opening, I'll see if I can go abroad. This is going to be a strong learning experience for me. Let me see what I can do about this. Okay, life goes on. Maybe I'll learn something. Maybe there'll be some fringe of benefits from this. Let me see. Let me go through it. Life will always go on. No worries. Okay. So I'm not going to think about consequences. All right. Positive outlook with life and people. So I'm not going to blame anyone else for this. I'm not going to say because of that guy in college I had to leave the job and see because of him now this has happened to me. No, this was my decision. I made this decision to open the clinic, isn't it? Okay, so it's my responsibility, it's my problem, and I'm going to solve it. The buck stops with me. Okay, so I'll see how to go forward with it. Loose cannon. I'm not going to sit and cry about it. I'm not going to call up a friend and become a liability on him and saying, "Oh my God, see this has happened," and then the friend is just going to judge me there. This is my problem. I have to solve it now. Maybe I can talk to my wife. I can have a reasonable discussion that this is how it is. How are we going to go ahead now? Okay, baby, and I'm not going to talk loosely, and I'm not going to tell my attenders I won't be able to pay your salary today. Oh my God, please forgive me. That kind of drama doesn't come in here, isn't it? I'm not going to be a loose cannon. I'm going to handle it. All right. Okay, I'm going to keep it to myself. Wife, yes, I can talk to my wife. We can have a good, reasonable discussion without, me asking for too much sympathy. And my wife is also not going to be too sympathetic. And we'll deal with this problem. All right. It's our problem and we'll deal with it. Now, finally, the last thing, what am I going to do about this? Okay, this is what I have to think. There is a problem. Of course, there is one. Now, what am I going to do about it? So, what am I going to do about this particular problem? Let's see. So, in practice, there's a magic word. They're called as referrals. All right. Now, referrals can come through various sources. Now, if you've opened a practice or if you've opened a startup, okay, whatever, okay, if you've opened your own enterprise, referrals is a very, very important term. What are referrals? There are various kinds of referrals. One is called as patient referrals. Patient referrals is my dad has been a practicing doctor for 50 years. So he's always taught me that one patient brings another patient, what you call as word by mouth. When you work on one patient professionally, he'll go and tell another patient and bring another patient. That is how slowly, this takes a long time, but yes, this is the most solid form of referral, patient referrals. What is the next form of referrals? They're called as board referrals. So when you open your startup or when you open your practice or whatever you open your enterprise, your board has to be visible. When people go up and down, they'll see your board. Okay, whether they come to your clinic or not, they'll see your board and they'll keep it in mind. Maybe next time there is something, they may just walk in into your startup. So board referral. So you have to have a nice professional board which is visible, regardless of whether your practice is on the second floor or inside a building. There has to be a board which is facing the road. Web-based referrals are very, very important. You have to have your own website because the patient always sees your website before he walks into your clinic, and your website should be very professional, professionally done, without being too loud. It should showcase your professional achievements, your hard skills, your degrees, your testimonies, that kind of a thing, and your interiors of your clinic, so that the patient can take your sterilization protocol, so that your patient can, have an impression about your clinic before he walks in. You should be present on all the various websites, on all the various platforms, Google, and there are so many other platforms. You should be there on Facebook. You should be there on, you should have a page on Instagram, and you should be present on social media. Not over market yourself, but not under market yourself as well. Maybe post your cases on various social media so that your fellow professionals, there are so many other, Facebook, you don't know what gets shared, and social media, you don't know how things get shared, so you don't know where your clinical work may reach. So it's very important to have patients search on Google and they'll come to you. Very important. Web based referrals, social referrals. So you may have extremely good hard skills, but you should have very good social skills as well. All right. So your personality should be that kind where people, you should be a very likable personality. People with a high EQ are very likable. They are very easily able to connect to people, or people are very easily able to, connect to them. They are generally very likable. They, they don't really, like I told you, one of the important things is they have positive outlook towards people, people with a high EQ. So they don't judge people for little issues. They just take the little issues in their stride, and they make an effort to like people because their self confidence is high. It's like they like themselves and they like other people, and they don't judge other people. They don't bitch about other people. Bitching brings in a lot of negative energy, and it sends out very bad vibes from yourself to others. So these people are generally very likable. So generally, they get a lot of social referrals. Their relatives, they say their relatives will come to them. Their friends will come to them. When, friends of their friends have some treatment, some friend has come from abroad and he asked this particular friend, I have to get an implant done. Where should I go? They'll just say, go to Dr. Ashwin Rao. He's a very good implantologist. Not because he's ever seen my implant skills, because just everything in life is personal. He likes me, so he's referred a patient to me. So this is very important. That is why, as a doctor, having a high EQ is very important. Please understand that, students. It's not only about your hard skills, it's about having a high EQ through the six characteristics, and it's about generally being, you're a social animal. You're not going to treat you're not an animal like a lion or a tiger. Okay, you are a social animal. A human being is a social animal. So you have to understand the fact that everything in life is personal, and people are going to refer patients to you, or they're going to come to you only if they like you as a personality. Even if you are the best dentist in the world, but you are a very, you're a very uh, what word do I say? Unlikable person, no, no, you're a snob. A snob, then, even if you're the best dentist in the world, they'll go to someone whom they find likable. So your soft skills are very important, and you have to work on it very by bringing into these, by bringing into play the six characteristics that I told you, especially about people. Have a positive outlook towards people. Okay, very important. Professional referrals, you should be part of your IDA. You should be going and meeting doctors, so that give professional referrals, maybe, and you should be part of a lot of groups in your country and abroad on social media, WhatsApp, and everything, where your fellow professionals are also there, and you keep posting your cases. Very important, because let's say a patient from Delhi is coming to Mangalore, and he asks his Delhi dentist, where should I go? I have to get an implant done in Mangalore. Where should I go? So he'll say, oh, you can go to Dr. Ashwin Rao. Me personally, but he'll know me from this social media platforms. All right. So these are various ways, uh, through which practice can be built up. All right, and this is, you have to consciously work on this. And let's say now I've opened my clinic, and I'm going to consciously focus on these modes of referrals. And rest assured, when I do all of this, slowly the patients will begin to trickle in, very slowly, and over a period of time, automatically, through these referrals, my practice is going to boom. And there'll come a time wherein I'll be so busy, I'll be so busy, where my appointments will run into weeks, and then I'll put in an extra chair, and then I'll put in the second chair, and then I'll increase my staff. I'll appoint an associate, and in a few years time, I'll have a big practice, and then I'll have to take on a more of a leadership role, wherein I take on only the most difficult treatments, and I begin to delegate the simple treatments to my associates. And this is how I'll have a fulfilling career. And this is how I've solved this problem. This is how I've resolved. When I resolve problem, what do you think will happen to me? I'm going to become a stronger personality. I'm going to develop a more high EQ. So this is one problem that I've solved. Yeah, I hope that made sense to you. I hope you could process this information, because I understand you are still students. I don't think so. We have anyone who's completed the BDS, but I hope you are able to process all this information, and how you can use six characteristics of high EQ individuals to solve problems. This is one example that I gave you. All right. Now, when I say push your emotions aside, I don't mean suppress your emotions. Emotions are very, very important, isn't it? Okay, emotions are important. You should not suppress your emotions. So, what will happen when you suppress your emotions? So, I always like this particular video. Pranjali, I hope we can play.
Yes, sir, we can hear the video.
All right. This thing here. If you've seen this, suppress his emotions. He's suppressing his emotions. Well, this is something which always I find it really funny. But the bottom line is, what is he doing now? What is Bowman Irani doing there? He's angry, but he's suppressing his emotion. Okay, that was just in a lighter vein. You should never suppress your emotions. What will happen when you suppress your emotions? I've about something called as a hurt ego. What is a hurt ego? When you have a problem and when you have two id and ego fighting for space there, and ego is trying to resolve that problem, and ego is not able to resolve that particular problem, what happens? That it you end up with a hurt ego. Hurt ego is an ego which is not able to solve your problem. Okay, so happens when there's a hurt ego. So according to Sig, when there's a hurt ego resorts to something called as defense mechanisms. All right, now you learn about it in your child psychology classes on what is defense mechanism. I'm not going to go into its detail. Let me give you an example of a defense mechanism. One of the defense mechanisms which the ego will resort to is denial. All right, it will just deny that there's a problem and it will just go forward. Okay, that problem remains unresolved, but ego doesn't know what to do with that particular problem. It has not been able to solve it. The problem has been taken over by emotions. Ego and super ego have clouded that problem and taken over it, and ego doesn't know what to do with it, so it has resorted to denial, and you have gone forward with your life. All right, so what happens then? Well, according to Sigmund Freud, he's come out with something called as the iceberg theory. So he says when a problem remains unresolved, whether it is a small problem or a big problem, a professional problem or a personal problem, when a problem remains unresolved, the ego may resort to defense mechanisms and it may just suppress that problem, but that problem is not going to go away. Your brain is like an iceberg. Okay, there are three layers to it. So the layer that you're conscious about, the layer that you're aware of, is what you call as the conscious part of your brain. Okay, consciousness is now and in the present. You are aware of it. Okay, you can see that there's you can see now that there's some background. What do you see? I don't know. Maybe there's a bookshelf there, and now you're listening to this lecture. Now you're in the present, the conscious. You're aware of it. Then you have something called as a pre-conscious. Is something wherein from your short memory you can retrieve something. If I ask you what is the name of your class teacher in 10th standard, immediately you won't remember, but you'll draw back from your memory and say, yeah, she was Mrs. So and so or Mr. So and so. Okay, that is called as a pre-conscious. Then there is a huge part of your brain, according to Sigmund Freud, which you're not aware of, which you don't even know that it exists. All right, and when your problems remain unresolved, according to Sigmund Freud, the ego will resort to defense mechanism and suppress it, but the problem is not going to go anywhere. It's just going to gently submerge, go deeper and deeper and settle into your unconscious mind. And what happens to that problem in your unconscious mind? It can come out through various ways. Maybe you'll have strange of dreams or nightmares which you can't explain. Your unresolved problems. If you go to a psychologist or a psychiatrist and he digs in deeper, then he may trace back your strange dreams or nightmares to some big unresolved problem, something which has affected you really deeply in life. He may trace it back to that. Or problems, if it's affected you really badly and you've just suppressed it and you've moved along with your life, they may cause subtle changes in your personality. You won't be aware as to that you're reacting to a particular problem in future in a particular way. But that is why each one of us is different, isn't it? That is personality means how we react to a particular situation. Why don't all of us react to a particular situation in one particular way? Okay, that is because each of our personality is different, and our person our experiences and how we have resolved challenges and problems in life. So some of us will have a mature personality, some of us will have an immature personality. All right. So in the previous example, now, if I had gone forward in life, closing down my clinic and where my ego was not able to, somewhere it'll cause a change in my personality. Next time, I'll be scared before I take up in any initiative. Even if someone else is taking up an initiative, I'll go and tell him, no, no, don't do that. I'll find problems with everything in life. In any initiative anyone is taking, my son also wants to take up a new sport. I'll find out deficiencies in that initiative. I'll say, don't take up sport. This sport, there's so many things can go wrong. You take up cricket, the ball can come and hit your face. I'll become that kind of personality because I'll end up making my son also a sissy, something some because that's because I've had this set of problems which I've not been able to resolve, and over a period of time I've become a very weak person, so as to say. All right. Okay, so that is one more consequence of problems getting into your unconscious mind, or your mind can resort to what you call a symbolic behavior. Now, what is symbolic behavior? I'll give you an example. Let's say I studied in a boys' school all my life when I was a kid. Till 10th standard, I was in a boys' school. I had no exposure to girls at all. All right. The first time I was exposed to a girl was when I was in my adolescence and my hormones were full blown. I was an adolescent, and that is the first time I got exposed to a girl in my tuition class. There were two girls in my tuition class. All right. Okay, so I handle that situation the first time I was interacting with the opposite sex. This is obviously this is not a true story. Okay, I'm just giving you an example in a lighter vein. Or any adolescent like me, let's say, who has never been exposed to the opposite sex, and suddenly there are two girls in his tuition class, and everything goes out of his windows at the peak, and it doesn't know how to handle this situation. So obviously, let's say I fall for one of the girls, okay, without knowing her. I just said hi to her, and that day I've had a massive crush on her. At night, I go home singing that song, that Pehla Nasha song. You remember that Amir Khan one? All right, where he falls on that tea bush behind him. You remember that song, I hope. Okay, so I have this huge crush on this girl, and next day I go and confess my I love to her. I go and tell her I love you. And obviously, girls are always more mature in these matters. That's a no-brainer. All right. So this girl, obviously, when I go and confess my love to her, she says, "Buzz off, you loser." Now there's a problem, isn't it? There is a problem. Now I have two sets of emotions clouding my head. One set of emotions is Eid, where I'm really angry. How this girl called me a loser, and I'm really angry. I want to give her a piece of my mind. I'm physically stronger than her. You know, in the the real bad classes of our society. If you've seen that movie Chapak, what has happened when that guy got rejected? His Eid took over, and he goes and splashes acid. Completely disgusting, isn't it? you know, completely unacceptable and disgusting. That is because the Eid took over everything. Okay, if the guy is, let's say, assume, if physically stronger than the girl, then he, strangles that girl, or assaults that girl. And these things happen because the Eid has taken over. All right. So Eid is one set of that are clouding my head, and on the other side, I have super ego trying to cloud my head, wherein I'm saying the girl called me a loser. Oh my God, I'm a loser. Then I go and hit the bottle, or I take a knife and I slash my wrists, and blood comes out, and I write a letter to that girl in my blood. All kind of drama, melodrama. Which girl will end up with a sissy like that, who cuts his every small thing, isn't it? Okay, but super ego has taken over my head there. So this is what happens, and ego is doesn't know how to resolve this particular problem. So what happens is, let's say the ego is not able to resolve this problem. So I'm basically talking about what symbolic behavior is, and I'm giving you an example to that. So when ego is not able to handle that problem, maybe ego will resort to some kind of defense mechanism like denial, and it gets suppressed. And then what happens when it gets suppressed, it goes into my subconscious mind, and I move along in life. 8 months later, 10 months later, I've moved along in life, but that problem is unresolved, and it goes into my subconscious. Then one day when I go into the mall, I see this shirt. I'm born on April. Okay, my birthday is April 17th, so I see this shirt. As an April guy, I'm not the one who needs a girl. I'm the guy a girl needs. And I immediately, I can relate to this particular t-shirt. And even if it's way beyond my budget, I go and buy this shirt, and I wear this shirt to every possible place. And every time a girl comes in front of me, I fluff my chest and show it to her. You can see many times as adolescents, 14, 13, 15-year olds, they wear these funny shirts which have got funny sayings on them. And as you grow up in life, when you're 20, 21, 22, you look back at these guys and you laugh at them and you wonder why they're wearing a shirt like this. you know the reason they're wearing funny shirts like this is one of the reason. It is symbolic behavior. There is an unresolved problem there. All right. Okay, so I hope you understood this concept of symbolic behavior. All right. Okay. So what happens if I'm an emotionally mature kid? If I'm a kid with a high EQ, how will I resolve this problem? That the girl called me a loser and told me to buzz off. Now, how am I going to resolve that problem? Well, I'm going to resolve that problem. If I'm an emotionally mature guy, I'll bring into I'll bring into count these six characteristics again. All right, I'll push the set of emotions aside. I'll have faith in myself. I'll say, okay, if I don't get this girl, that's okay. I'll move on with life. I'll have a positive outlook. I'm responsible. I was an idiot. Without knowing her, I went and just, told something stupid like that. I'm not going to be a loose cannon where I'm going to be a burden on my other male friends. I'm going to bore them to death with my failed love story. I'm going to see what I'm going to do about it. So, what I'm going to do about it? Okay, I'll sit and think. Now, maybe the next day I'll go and tell the girl, look, I'm sorry, I was a jerk. I shouldn't have come and told that to you. Now, is it okay if I can take you out for an ice cream? Can we do that? And maybe the girl will say, yeah, sure, we'll go out for an ice cream. And then, I'm an interesting guy. I dress up well. I have a good sense of humor. Maybe the girl will, over a period of meeting, she may actually begin to like me, or, we may end up becoming thick friends. But the ego has resolved that problem. And that is very important in a mature manner. All right. So, dear students, I'm at the end of my presentation. Okay. Uh, so please look at these six characteristics whenever you had a problem. Whenever you have a problem, try and resolve this problems logically, because EQ and IQ, all of us have a high EQ. It's not EQ versus IQ. A doctor needs both EQ and an IQ. Okay, a doctor needs to be brilliant, and a doctor needs to have enough empathy also. He needs to be a person with lot of emotional intelligence. He needs to be an emotionally mature person, because your patients as a doctor look upon you as a person, who can mentor them. They come and tell their personal problems with you because they feel that, doctor as a profession, they are people with a very high EQ. So you need to be brilliant in skills, but you need to have very high levels of empathy as well. So I hope I kept up my promise. I hope I was short. I don't know how much time. It's 17:01, so I started at 6 o'clock. Okay, I took about an hour. I'm sorry if I went overboard. Uh, but yes, I hope I kept up my promise. I hope it was short. I hope I kept it interesting, and I hope there's at least one point that you could pick up. Thank you so much. Thank you so much. Pranjali, I don't think so. We'll have time for questions. I'm sure the going on. So,
Yes,
uh, yeah, if
yes, sir.
there's
Thank
something,
you so much
you can
for
just
such a
mail me.
wonderful, yes, yes. Yes, sir. Thank you so much for such a wonderful, wonderful session. And thank you for taking time out on a Sunday evening for us. And this session definitely felt like diving into that famous book by Sigmund Freud, The Ego and the Id. And I'm sure all of us learned and wondered of ways to implement it in real life. And thank you for throwing light on the current scenario, about the whole examples of Chapak and the assaults and all of that, and how it can be resolved by applying this to our daily lives. And those six characteristics are so versatile that it can be applied to any predicament in our life at any point, basically. But it always makes me wonder if EQ is innate or acquired, because you know how doctors and dental surgeons in India are supposed to are expected to have more EQ that I mean I'm sorry more IQ than EQ, because it is a requirement for